Hey guys, tonight we begin with healing in ancient Egypt and the incredible figure of Imhotep, the only mortal man to achieve full godhood in medicine. He was a physician, architect, and chief minister to a king, basically the ancient Egyptian version of a polymath superhero. So before you get comfortable, take a moment to like the video and subscribe, but only if you truly enjoy what I do here. And let me know in the comments where you're tuning in from and what time it is for you. It's always fascinating to see who's joining us from around the world. Now, dim the lights, and let's ease into tonight's journey together. Welcome everyone to the channel Historian Podcast. The sun rises over the Nile as an Egyptian healer prepares for another day's work. In a small mud brick clinic by the temple, jars of herbs and minerals line the shelves, and the air is thick with the scent of incense. Finally, a patient arrives. He's wounded his arm. The physician carefully washes the injury with wine and honey and recites a quiet prayer to invoke the protection of the divine. This could easily be a scene from ancient Egypt, a land where medicine and magic walked hand in hand. From the dawn of pharaonic civilization, the Egyptians developed rich traditions of healing practices that combined practical treatment with spiritual relief. They recorded their medical knowledge on papyrus scrolls, performed surgeries with copper tools, and truly believed that gods and demons could influence health. Today, we will journey through thousands of years of Egyptian history, exploring how their medicine evolved from the early days of pyramid builders to the eras of the great pharaohs. We'll rely on ancient sources of legendary physician priests, examining the medical papyri they left behind. Step into the healing temples and discover the ailments and remedies of a long-ago world. So, I hope you're ready, and I hope you're excited to be immersed in the story of medicine along the Nile. It's one of innovation, mysticism, and the timeless human quest to cure our illness. Healing in ancient Egypt. It began in prehistoric times and developed during the early dynastic period. We're really going back to the earlier practices. You see, even before medical texts were even thought about being written, archaeological evidence suggests that Egyptians had at least some knowledge of treating injuries. Skeletal remains show well-healed bone fractures, indicating effective splinting and care. The world's first known physicians emerged in Egypt's early history. One record preserved by later historians speaks of a healer named Set Anak, who served the pharaoh Sahura of the 5th dynasty, and that's the 25th century BC, by the way. Apparently, he knew what he was doing because he cured the king's nasal illness. While the exact date in that account is uncertain, it reflects the high esteem for healers even in the Old Kingdom. By around 2750 BC, during the 3rd dynasty, the famed polymath Imhotep rose to prominence. He served as a vizier, that is, the chief minister to King Djoser, and was renowned as a physician, architect, and sage. Egyptian tradition credited him with exceptional medical wisdom. Many Egyptologists even speculate that later medical writings, though compiled long after Imhotep's time, might echo his teachings. Think of him in the way that the Greeks have Galen. Yes, the Greeks have Galen. The Egyptians had Imhotep. In fact, Imhotep's reputation grew so great that over 2 millennia later, he was actually deified as a god of healing, the only mortal in Egyptian history to attain full godhood in medicine. So he must have knew what he was doing for sure. That's a promotion that really can't be beat. Imagine having your job title changed to divine healer. Talk about a raise. Well, as we go into the Old Kingdom, that is 2700 to 2200 BC, physicians held quite respected positions at court and in society. We know this from tomb inscriptions which give glimpses into these early doctors. For example, The Hesi-Ra, who lived around 2600 BC, is often cited as the first recorded physician and dentist. His titles included Wer Ebe Senui, which scholars translate as Great One of the Dentists or Physicians, indicating he oversaw general dental care and medicine. Hesi's tomb art even depicts him in the act of treating patients, confirming that organized medical practice was certainly taking root at this time. Interestingly, his titles also name him a chief of scribes and a magician, showing that an accomplished Egyptian healer was expected to be literate and versed in magical rituals as well as practical techniques. It's a blend of roles: the scribe, the doctor, the priest, magician. It would characterize Egyptian medicine throughout its history. This is where we first see that delightful blend of rational observation and saying a secret word to make the boo-boo go away. By the end of the Old Kingdom, Egyptian healers had established a solid foundation of medical knowledge, much of it likely passed down orally or through temple training. They understood basic anatomy from practical experience and possibly from religious rituals, like mummification, which was beginning to be developed at very early times. There are hints that early physicians performed simple surgeries. A tomb at Saqqara from around 2500 BC contains carvings that may depict surgical operations. In one famous 6th dynasty tomb, a scene shows what appears to be the circumcision of a patient, one of the earliest depictions of surgery on the human body. By this time, healing was a valued profession, and Egyptians would continue to expand their medical expertise in the centuries to come. Well, we're certainly off to a good start, aren't we? Historians still debate whether the contents of later medical papyri like the Edwin Smith papyrus truly originate from Imhotep's time, or if his name was simply attached much later to give the documents greater authority. It's a bit like claiming a new self-help book was secretly written by Leonardo da Vinci. The air inside Hesi-Ra's tomb, which contains those early reliefs, must have felt like a cool, heavy blanket, a sudden relief from the searing Egyptian sun. Imagine the rich, earthy smell of the millennia-old dust mixing with the faint, lingering scent of natron and the damp limestone, a unique atmosphere that felt both sacred and slightly claustrophobic. The silence in those burial chambers was absolute, broken only by the echo of a breath, amplifying the sense of being surrounded by the quiet wisdom of ancient, observing eyes. The stone beneath your fingers would feel cool and smooth, polished by time, contrasting sharply with the rough, dry texture of the sand outside. Well, as Egyptian civilization progressed, healers began recording their knowledge on papyrus scrolls, and that's left us with some of the oldest medical texts in history. These medical papyri are primary sources, and they let us glimpse into ancient diagnoses, treatments, and even the spells used by doctors. Because like I said, they walk hand in hand. The surviving documents span over a millennia, circa 1900 to 1200 BC, and cover various specialties. The Egyptian papyri were typically written in the cursive hieratic script, which is a simplified form of hieroglyphs using black ink for the main text and red ink for headings or highlights. They often start by invoking a deity or giving credit to a legendary figure like Imhotep, then proceed to list cases, prescriptions, or incantations. One of the earliest extant medical texts is the Kahun Gynecological Papyrus, dated to around 1825 BC in the 12th dynasty, discovered in 1889 at the town of Kahun. This papyrus focuses on women's health. Obviously, it contains 34 sections dealing with gynecological problems, fertility, and pregnancy. Each section provides a description of symptoms, guidance for diagnosis, and then recommending a treatment. Notably, all remedies in the Kahun papyrus are non-invasive, reflecting a conservative approach to internal ailments. Of course, You didn't really have anesthetic back then, didn't you? Wanted to avoid cutting people open as much as possible. There is one interesting little remedy in the papyrus to promote contraception. One Kahun recipe advises mixing crocodile dung with honey or sour milk and inserting it as a pessary. The striking, if unappealing, method perhaps relied on creating a physical barrier. Well, I would guess that that's a pretty effective contraception. I don't think you'd have many men going near you with that. That is an unusual detail, to say the least. Maybe the ancient Egyptians thought that if it smelled bad enough, the potential problem would just retreat entirely. Imagine presenting that prescription to your modern pharmacist. Either way, jokes aside, the document shows that by the Middle Kingdom, Egyptian doctors had a specialized understanding of female reproductive health and were systematically recording their cases and remedies. The practical nature of many of the suggested remedies in the Kahun papyrus is quite remarkable, showing observational medicine at work. For instance, there are methods to determine if a woman will bear a child by having her urinate on barley and emmer wheat seeds. If the barley grows first, it means a boy, and if the emmer wheat grows first, it means a girl. If neither grows, she is barren. This sounds like an old wives' tale, sure, but the principle behind it, using urine to determine pregnancy, has a very distant echo in modern chemical pregnancy tests. It's an odd or unusual detail that shows how ancient science sometimes brushed up against folk wisdom. The detailed instructions on diagnosing and treating various gynecological symptoms, such as painful menstruation, problems conceiving, and prolapsed uteri, indicate a systematic approach to women's medicine. The Kahun papyrus even includes spells to be recited over the remedies, illustrating that seamless blend of the practical and the magical, even in a specialized field. They might have a rationally compounded herbal mixture, but they always added a little chant, just to be sure. You never want to risk an upset uterus demon. Historians still debate whether the specific method described for using the dung and honey pessary was primarily intended as a chemical barrier, or if the extreme odor and physical placement were considered a form of sympathetic magic to repel conception. Was it medicine, or was it just a very potent deterrent? The scent of the clinic near the temple, where a doctor might read this papyrus, was likely an overwhelming blend of sweet and acrid notes. Imagine the thick, almost sickly sweet fragrance of fermenting beer and honey, used as bases for medicines, clashing with the pungent, medicinal earthiness of crushed cumin and burnt resin wafting in from the brazier. The air would feel heavy with humidity, making the ink on the papyrus feel slightly tacky to the touch. The patient, perhaps a woman seeking fertility advice, would feel the dry, brittle edges of the papyrus scroll as the healer carefully unrolled the delicate sheet, its surface a pale yellow against the dark, practiced fingers. Another invaluable text is the Edwin Smith surgical papyrus, dating to about 1600 BC. It was purchased in the 19th century by Edwin Smith, an American collector, and later translated by archaeologist James Breasted. The papyrus is essentially an ancient trauma surgery manual and stands out for its rational and almost modern approach. It presents 48 clinical cases of injuries to the head, neck, torso, and limbs. For each case, the text describes how the wound looks and feels, the examination, and gives a diagnosis or prognosis. This ailment I will treat, or in some cases an ailment not to be treated, and then it outlines the treatment, if there is one. The Edwin Smith papyrus shows Egyptian surgeons employing advanced practices. Wounds were closed with stitches, bandaged with lint, and treated with antiseptic applications such as honey to prevent infection. Bleeding was staunched by pressing raw meat on the wound to encourage clotting. There are detailed instructions for setting broken bones and dislocated joints, too. For instance, instructions to immobilize the head and neck for neck injuries, much as modern first aid would do. One case even describes a cervical spine injury with paralysis, correctly noting it as untreatable and likely fatal, which indicates keen observation of cause and effect. The Smith papyrus is remarkably empirical and contains very little magic. It almost reads like a military field medic handbook. However, on the back of the scroll, call that the verso, by the way, a few magical spells are recorded, perhaps added later as a supplement. This unique text may be a copy of a much older work, though some attributed its content to around 2600 BC, possibly reflecting the era of Imhotep. But regardless of authorship, it demonstrates that Egyptian surgery, especially in trauma care, was highly developed for the time. This contrast between the highly rational front side and the magical back side is an odd or unusual detail that really underscores the transition and tension between observation and superstition in Egyptian medicine. Egyptian doctors recognized which cases they could handle and which were hopeless. They categorized injuries as treatable, contestable, or untreatable. A triage system is outlined as follows. Treatable injuries were those that dealt with active interventions dealt with immediately, Then we have contestable injuries, that is serious but not life-threatening wounds where the patient might survive without intervention. In such cases, the physician would observe and only step in if needed. And then we have untreatable ailments, injuries so severe that there was just nothing they could do. The physician would not intervene beyond measures of comfort. This pragmatic approach saved resources for those patients who could be helped and shows a clinical wisdom in ancient Egyptian medicine. It's the ancient equivalent of saying, "We can patch this up, let's wait and see," or the very somber, "Call the priest." It's an interesting system that has held up for millennia. The fact that the physicians explicitly classified cases they would not treat is a legitimate historical event demonstrating a high level of medical ethics and realistic prognosis that you wouldn't expect in such an ancient era. It takes a certain amount of scientific humility to say, "This is beyond my skill, and intervention will only hasten the end." Imagine the feeling of a freshly cleaned wound being stitched closed. The patient would feel the sharp, quick pain of the copper needle pulling linen thread through the skin, a sensation quickly followed by the cool, sticky application of the honey-soaked lint. The thick, syrupy consistency of the honey would feel soothing, yet slightly heavy, spreading its sweet, pervasive scent over the wound, momentarily masking the metallic smell of blood. The physician's touch would be firm and quick, a necessary roughness born of skill and urgency, making the patient acutely aware of the throbbing heat radiating from the injured area. Historians still debate whether the categorization of untreatable ailments was solely based on clinical observation of irreversible damage, or if it also factored in religious beliefs about injuries caused by deities or demons that were beyond human intervention. The Ebers Papyrus is another monumental medical compendium written around 1550 BC during the New Kingdom. At over 20 meters long, not joking, 20 meters. It is one of the most extensive and best preserved medical papyri. The Ebers Papyrus is essentially a herbal and magical encyclopedia containing about 700 recipes and remedies for all manners of ailments. It covers diseases of the eyes, internal organs, skin, digestive problems, dental issues, and more. Significantly, Ebers includes a section often called the Treatise on the Heart, which reveals that the Egyptians did have an understanding, if rudimentary, of the cardiovascular system. It notes that the heart is the center of the blood supply, with vessels leading to every part of the body. These vessels, according to Ebers, carry not only blood, but also air, water, and other fluids to the limbs and organs, and if they become blocked by evil or waste matter, illness occurs. This concept of bodily channels prefigures later ideas of circulation, albeit mixed with a few spiritual notions of evil substances causing blockages. But hey, it is what it is. It's a fascinating early attempt to map the body's internal plumbing, even if they were putting air in the pipes. But the Ebers Papyrus also demonstrates the pervasive use of magic alongside medicine. It explicitly states, "Magic is effective together with medicine. Medicine is effective together with magic," emphasizing that both approaches were seen as complementary. Many prescriptions in Ebers are paired with incantations to be chanted while administering treatment to enlist supernatural help. For example, a remedy for burns might also require reciting words invoking the goddess Isis to draw out the pain. The Ebers collection includes remedies for crocodile bites, pains from head to toe, and even household pests. It has spells to rid a house of rats and scorpions, which I'm sure is pretty useful. Remedies range from the practical to the bizarre, a mixture of science and superstition, certainly characteristic of much of Egyptian healing literature. That's what makes it so fascinating, I think. The sheer scale of the Ebers Papyrus, 20 meters, is a legitimate historical event and a powerful testament to the volume of codified medical knowledge the Egyptians had amassed by the New Kingdom. Imagine rolling that thing out in a busy clinic. You'd need a whole wing of the building just for the consultation. Beyond these three famous papyri, many other medical texts have been found showing the breadth of the real knowledge. The Hearst Papyrus of 1550 BC is a collection of recipes for internal and external ailments, heavily utilizing honey. The Berlin Papyrus of 1300 includes sections on obstetrics and an introduction to the heart and vessels similar to the Ebers. The London Medical Papyrus, circa 1300 BC, contains both medical and magical recipes illustrating that crossover. The Charles Bay Medical Papyrus of 1200 BC specializes in proctology with treatments for anal ailments. In total, scholars have identified fragments of over 40 medical papyri from ancient Egypt, covering everything from ophthalmology to pediatrics. These papyri were often stored in temple libraries, or houses of life, as they were called, per ankh, which were part scriptorium, part school, and possibly part clinic. Together, the texts paint an impressive picture by the New Kingdom. Egyptian medicine was literate, codified, and wide-ranging. The tone of authority and detail in these scrolls suggested they were based on long experience. There were practical manuals for practicing healers. Through the papyri, the wisdom of Egyptian physicians could be passed down through generations. The odd or unusual detail here is the Ebers Papyrus's belief that vessels carried air and water as well as blood. They clearly understood a circulatory network, but hadn't quite nailed down the contents. They were halfway to understanding a water-cooled, air-conditioned internal system. The scribe meticulously copying the hieratic script onto the long papyrus would have felt the rough, slightly porous surface resisting the reed pen, which would make a faint, rhythmic scratch-scratch sound in the quiet house of life. The air would be still and dry, preserving the ink, and the smell of the natron-infused size used to treat the papyrus sheets would be distinct. A sharp, mineral scent that meant preservation and permanence. Historians still debate whether the Egyptians' concept of the vessels was purely anatomical, based on observations during mummification, or if it was primarily a theoretical concept influenced by the Nile's system of canals, seeing the human body as a microcosm of the life-giving river system. Of course, as you can imagine, in ancient Egyptian society, physicians were held in quite high regard, often with considerable status and privilege. Being a physician usually meant being part of the educated elite. Most doctors would train as scribes as literacy was essential to read the medical papyri and to record cases, and scribes were among the most respected classes in Egypt. So doctor-scribes occupied a specially honored social position, sometimes even serving directly under the pharaoh. In fact, many physicians also bore priestly titles and served in temples, once again blurring the line between religious and medical professions. For instance, doctors frequently served as priests of Sekhmet, Sekhmet being the lion-headed goddess of war and plague, who also had the power to avert disease. The Egyptians believed Sekhmet could unleash epidemics or protect people from them. So her priest-physicians were considered very powerful healers. An inscription might refer to a healer as servant of Sekhmet, or one whom Sekhmet has taught, indicating a divine endorsement of their medical skill. Egyptian physicians could be highly specialized, a fact noted even in antiquity. The Greek historian Herodotus, writing around 450 BC, marveled at the quote, "The practice of medicine is so divided among them that each physician is a healer of one disease and no more. The country is full of physicians, some for the eyes, some for the teeth, some for the belly, and others for hidden diseases." This suggests that by the late period, Egyptian medicine had departments, each focusing on their own field. Imagine trying to get a full checkup. You'd be bouncing from specialist to specialist all day. Indeed. Well, it's quite funny that the specific title for a proctologist is the guardian of the anus, which, well, you can't help but laugh at that. But there's also another one, the shepherd of the royal rectum. Somewhat humorous-sounding title for the pharaoh's enema specialist. These are the kind of titles that appear in the medical texts, confirming a degree of specialization. This is a very odd or unusual detail that makes you wonder exactly how formal those court meetings were. I bet that was a title that got a few giggles in the scribal community, too. Such specialization likely existed earlier as well. For example, tomb inscriptions from the Old and Middle Kingdom mention eye physicians of the palace or court dentists. And as noted, Hezirah held the title of chief dentist, implying a focus on dental health as early as the 3rd dynasty. We also know of Pesishet, 2500 BC, a woman who carried the title overseer of female physicians. She's the earliest known female doctor by name and may have trained other women in medicine. Her existence mentioned in Old Kingdom tomb inscription confirms that women could practice as physicians in pharaonic Egypt. While the majority of known doctors were male, sure, there is evidence that women worked as midwives, healers, and even official physicians, especially in treating female patients. The high status granted to physicians, placing them among the scribal and priestly elite, is a legitimate historical event that distinguishes Egyptian medicine. It shows the profession was institutionalized and highly valued by the state. The environment of a new kingdom court physician would be one of immense privilege and clean linen. They would feel the cool, fine texture of starched linen robes against their skin, a mark of their elite status, contrasting with the humid, coarse wool worn by common people. The court air would be heavy with the rich, expensive scent of imported frankincense and myrrh burned in censers, used both for perfume and to ward off illness. The ground beneath their sandals would be polished stone, cool to the touch, and the subtle, rhythmic sound of the pharaoh's distant musicians would be a constant, low thrum in the background. Historians still debate whether the high degree of specialization was as widespread as Herodotus suggested, or if he merely observed the practices of the capital city's elite healers who catered to the most complex and delicate health issues of the royal court and wealthy. The training of a physician typically took place in temple institutions called houses of life. These were libraries and teaching centers attached to major temples such as the one at Heliopolis. That means city of the sun, by the way. It's our Greek name for it. Helios being sun, polis being city. Also at Thebes, and later at Sais. A student physician would study medical papyri, learn anatomy and herbalism, and also be instructed in religious rites. Much of the curriculum would involve memorizing recipes and spells from existing texts and observing experienced doctors' work. The atmosphere in these houses of life was one of intense, quiet study, a bit like a medieval monastery mixed with a science lab. By the New Kingdom, there was a clear hierarchy among doctors as indicated by titles found in stelae and papyri. There were ranks such as chief of physicians, eldest physician, overseer of physicians, and inspector of physicians. For example, an inspector of doctors might have been responsible for evaluating practitioners or administering medical services in a certain region. At the very top, some physicians served as royal doctors in the pharaoh's court. These might accompany the king and treat the royal family, and the prestige, of course, was immense. Some were even rewarded with lavish tombs. One inscription from the New Kingdom mentions a court physician who was also, quote, chief of the king's writers, highlighting that doctors could attain high administrative office, too. That's a good career path. Start by checking the pharaoh's pulse, end up running the entire bureaucracy. It is important to note that in Egypt, the roles of the physician, the priest, and magician could, and often did, overlap significantly. Many doctors were technically priests, especially of deities connected to healing, such as Sekhmet, Thoth, and later Imhotep after he was deified. Conversely, many temple priests had knowledge of practical healing for ailments of their flock. This dual role was not seen as conflicting. Rather, it was somewhat expected. Egyptians didn't sharply separate what we call medicine from religion or magic. They saw it as a holistic enterprise to restore Ma'at in a sick person. Ma'at being that cosmic order and balance. Thus, the healer's status was somewhat multifaceted, part scholar, part scientist, and part clergyman. Being learned in medical text and skilled in drug preparation was important, just as knowing the right prayers and incantations to invoke divine aid was. This combination of attributes made the physician-healer respected and somewhat of a feared individual in the community, one who dealt with the forces of life and death and the supernatural. The fact that the entire medical system was often administered through temple institutions like the Houses of Life is a legitimate historical event. This solidified the link between spiritual and physical healing and ensured that medical knowledge was preserved and transmitted by the most literate class, the scribes. The hierarchy, with titles like Chief of Physicians, implies a structured, state-sponsored medical system, which is an odd or unusual detail for a society so ancient. They didn't just have healers. They had a full medical board. The student physician training in the House of Life would feel the intense mental exhaustion from endless hours spent memorizing complex hieratic scripts filled with recipes and spells. The smell of the humid river air, carrying the faint scent of lotus flowers, and the strong metallic aroma of the scribe's black and red iron oxide inks would pervade the study area. The heavy weight of the learning, the responsibility of potentially holding life and death in your hands, would be a constant, palpable pressure. Historians still debate whether the physicians who held priestly titles were primarily religious figures who also healed, or if they were secular doctors who simply adopted the religious title to access temple resources, patience, and the spiritual power of the deity. Of course, to the ancient Egyptians, spiritual forces were just entwined with health and sickness. There was no strict division between rational cures and magical ones. Both were employed together. You may as well have as many weapons against the illness as you can, right? That was the logic. In fact, there's an oft-quoted line from the Ebers papyrus that declares, "Magic is effective together with medicine. Medicine is effective together with magic," and this encapsulates the Egyptian approach. Physical remedies and spiritual rituals hand in hand. The Egyptians believed that many illnesses were caused by supernatural agents, the wrath of a god, the malice of a ghost, or the presence of a malevolent spirit or demon. A person's health was seen as a reflection of their relationship with the divine order. If someone fell ill without an obvious injury, it might be blamed on invisible arrows shot by angry gods, perhaps a curse, or the intrusion of some entity into the body. For instance, fevers and plagues might be seen as sent by Sekhmet when she was enraged. Nightmares or seizures could be attributed to some kind of demonic possession. Therefore, magical spells, incantations, and religious rituals were just a standard part of treatment protocols, not a last resort. A doctor was expected to know which incantation to recite for a snake bite and which god or goddess to invoke for a particular malady. The practice of Heka, the Egyptian concept of magic, was itself deified in the form of the god Heka, who personified magical power. Heka was often depicted as assisting the creator god in bringing order to the world, and by extension he was called upon by healers to restore order, that being health, in the human body. In fact, Heka magic was considered a legitimate force of nature, much like gravity or electricity today, that a skilled practitioner could harness. Doctors were trained in these magical arts as well. They were effectively physician-magicians. A healing session for an internal illness typically involved both therapeutic remedies, that is, potions, herbs, and poultices, and also ritual actions, the burning of incense, making offerings to a god, wearing protective amulets, and reciting spells. An ancient Egyptian patient might have an ointment applied to their skin, while the physician simultaneously chanted a spell like, "Fly out, scourge of the god, come forth upon the earth," something like that. Certain gods and goddesses were specifically associated with healing and frequently involved. We've already mentioned Sekhmet. Well, Sekhmet could both cause and cure epidemics. Her priests were learned in diagnosis and in performing rituals to appease her and avert plague. Isis and her son Horus were also central to magical healing myths. Isis was said to have healed Horus from a deadly scorpion sting using the power of spells. And those Egyptian healers often recited the spell of Isis for snake bites and scorpion stings. Amulets bearing the image of Isis, Horus as a child, or the eye of Horus, the Ujjat eye, were common protective talismans used in healing to ward off harm. Another goddess, Serket, was a patroness of venomous bites and would be invoked for anyone bitten by snakes or scorpions. Thoth, the god of wisdom, was thought to author many healing formulas. Doctors might utter, "Come Thoth with your magic and heal this patient." But overarching all of this was that concept of cosmic balance Ma'at, which healers sought to restore in a sick person's body and spirit. Every illness could be seen as an imbalance or disruption of harmony that needed to be set right through both physical and spiritual means. The belief that diseases were often caused by invisible divine or demonic forces, requiring Heka magic for expulsion, is a legitimate historical event that defines the holistic Egyptian worldview. This meant the healing process was as much spiritual warfare as it was medical intervention. The concept of invisible arrows causing disease is an odd or unusual detail to our modern medical minds, but it logically explained sudden, unexplained illnesses like stroke or fever. The intense, smoky smell of the incense burning in the brazier would flood the small clinic room, its thick, sweet aroma designed to create a barrier between the patient and the unseen malevolent spirits. The patient, feeling the low, rhythmic vibrations of the doctor's chanted spell resonating in their chest, might experience a deep sense of relief, the feeling of the doctor and the gods working together to drive out the unwelcome intruder. The air would feel charged, thick with the power of the spoken word. Historians still debate whether the physicians themselves genuinely believed in the literal demonic causation of all internal illness, or if the magical component was primarily included as a culturally necessary placebo effect to reassure and calm the patient and their family. Magical practice in medicine also involved the use of symbolic objects and written spells. Often a priest-physician would prepare a written spell on a scrap of papyrus or linen bandage and then bind it to the patient as an amulet. Alternatively, a spell might be inscribed on a bowl, which was then washed out with water. The patient would drink the water, thus ingesting the magic in a literal way. Some artifacts called magical wands or rods carved with protective deities have been found in tombs and are thought to have been used by magicians to circle around a patient, drawing a protective boundary. For childhood illnesses, a common practice was to place a statue of the household god Bes or Taweret near the child's bed to scare the demons away. Words themselves were considered to have power. Knowing the secret names of demons or gods could give one control over them. Egyptian healers memorized many such names and spell formulas for use in cures. Even in documents that are largely practical, like the medical papyri we discussed, spells are frequently mentioned. For example, the London Medical Papyrus contains 61 recipes, and 36 of them are purely magical incantations to cure diseases by expelling evil forces. The Brooklyn Papyrus from the 4th century BC, a little bit more modern, I suppose, is an entire manual on snake bite treatment that interweaves antidote with lengthy spells, enumerating every mythical name of snake demons to nullify their venom. The practice of drinking water washed over inscribed spells is a highly odd or unusual detail to us, but it was a legitimate historical event and a serious form of therapeutic magic for the Egyptians. They believed the water literally absorbed the Heka, or magical power of the words. Think of it as a very intense, ancient form of verbal homeopathy. I don't recommend trying this with your morning coffee, just in case. In daily life, when people faced disease, they often turned first to magical solutions. An individual with a persistent headache might wear a headband inscribed with a prayer to Thoth, or a mother might recite a charm over her feverish child, invoking the cooling breath of the north wind. These practices were not seen as contrary to medical treatment, just essential parts of it. The world view of ancient Egyptians simply did not separate the seen and unseen realms when it came to health. In Sum, spirituality, magic, and medicine were fully integrated into Egypt's healing practices, reflecting a more holistic approach. To heal the body, one must placate the gods and banish away any evil influences afflicting the soul. The practice of binding a written spell to the patient as an amulet meant that a healer's work was often literally worn on the patient's body, a tangible connection between the cure and the magical text. The patient drinking the magically charged water would feel a distinct, cold wetness on their throat, a sensory experience that marked the moment of ingesting the divine aid. The taste of the water itself might carry a faint metallic flavor from the stone bowl it was poured from, or a chalky residue if the inscription was made with a mineral pigment. The feeling of the linen amulet tied to a limb would be rough and scratchy against the skin, a constant, slightly irritating presence, serving as a reminder of the protection it offered and the unseen battle being waged within their body. Historians still debate whether the physicians who practiced both Heka and empirical medicine had two separate, consciously distinct mental frameworks, one for the spiritual and one for the physical, or if they operated under a single, unified world-view where the physical and spiritual causes of illness were simply two sides of the same coin. While magic played its part, sure, the ancient Egyptian physician was also a practical doctor, and he was equipped with an array of surgical tools and medical techniques. Archaeological finds and tomb illustrations have revealed a remarkable collection of instruments that Egyptian surgeons used, many of which have recognizable modern counterparts. In the inscriptions, we see depictions of items such as scalpels, forceps, scissors, hooks, lancets, probes, and even something akin to tweezers and pincers. These instruments were crafted from materials available at the time. Early on, sharpened flint or stone blades were used for incisions, later replaced by copper or bronze knives as metal working advanced, and by the New Kingdom, some surgical tools were made of bronze alloy, which could be shaped into fine blades and was easily cleaned. The famous temple relief at Kom Ombo, Ptolemaic period but reflecting earlier designs, shows a set of surgical implements including saws for bone, forceps, a mortar, and pestle for preparing remedies, and containers that likely held antiseptic substances like honey. The Egyptian physician's approach to surgery was a cautious one, but competent for the time because internal surgery was risky in an era without anesthetic or knowledge of infection control. Most Egyptian surgery focused on external injuries and superficial conditions. The Edwin Smith papyrus demonstrates the systematic treatment of trauma wounds. For a deep cut, the instructions were to suture the wound, close with needle and thread, and then apply raw meat on day 1 to stop the bleeding, and honey and lint bandages on the subsequent days to prevent infection and promote healing. The use of honey is repeatedly attested with good reason. Honey does indeed have natural antibacterial properties. Modern science has confirmed this, and the Egyptians wisely used it as a wound dressing in about 500 different remedies. They also employed resin and grease in wounds, ingredients that would help seal a wound from air and perhaps reduce infection. If a wound became infected or an abscess formed, Egyptian surgeons would open and drain it. The Kahun papyrus recommends lancing an abscess and inserting a strip of linen as a drain. They even understood a bit of orthopedics. A dislocated joint, like a shoulder or jaw, would be manually reduced or snapped back into place, using techniques quite similar to those still used today. Splints were devised for broken limbs. These could be made from wooden splints, or even tightly bound bundles of reeds padded with linen to immobilize the fracture. In one case, a type of plaster cast is described. Linen bandages soaked in a glue-like substance that hardened around the injured limb to hold it firm. The sheer sophistication and variety of the surgical instruments, as seen on reliefs like the one at Kom Ombo, is a legitimate historical event that proves the Egyptians were active, observational surgeons, not just potion mixers. This toolset was far more advanced than many European counterparts millennia later. The sensation of the surgeon manually reducing a dislocated shoulder, forcing the joint back into the socket, would be one of blinding, searing pain, followed by a sudden jarring click or thud as the bone returned to its proper place, instantly followed by immense, dizzying relief. The patient would feel the rough, cool texture of the wooden splints being tightly bound to their limb with linen, the pressure necessary to immobilize the broken bone, causing a dull, throbbing ache. And yes, they were doing this without proper painkillers, which is why they were so cautious about cutting. The use of raw meat on a wound to staunch bleeding is an odd or unusual detail that might seem strange, but it relies on the natural clotting factors found in the tissue, making it a surprisingly effective, if basic, hemostatic agent. Historians still debate whether the saws depicted on the Kham Ambo relief were used for bone surgery on living patients, or if they were primarily specialized tools used during the complex process of mummification to section bodies for specific burial rites. Minor surgical procedures were pretty common. Bloodletting, however, was not a major part of Egyptian practice, unlike later Greek medicine, but they did use cauterization to stop bleeding or to treat certain lesions. They treated boils and cysts by cutting them open. There is evidence from mummies that dentistry was attempted. A 4th dynasty skull was found to have a hole drilled in the jaw, likely to drain an abscess under a molar tooth. Toothaches were a prevalent problem due to the coarse bread that wore down the teeth. Healers would prescribe topical treatments for pain, and in some cases might have even pulled loose teeth. No extractions, and not well documented. A famous example of early prosthetics is a wooden prosthetic toe found on a mummy showing attempts to surgically replace a lost body part for functional or cosmetic reasons. This is a very legitimate historical event. A functioning prosthetic toe predating most similar Roman technology. It suggests a remarkable concern for quality of life and appearance, even after death. They wanted to make sure you could walk into the afterlife with the right stride. Egyptian surgeons were also adept at eye surgery for surface eye conditions. They could excise growths or drain inflamed eyelids. Any remedies for eye ailments are in the papyri, often combined with magic to address the very common problem of ophthalmic infections. But perhaps the most routinely performed surgical procedure was circumcision. Evidence suggests that it was a coming-of-age ritual for males and physicians, likely carried it out with a flint or bronze blade. An Old Kingdom tomb scene shows 2 men circumcising a youth with an inscription, "Hold him and do not let him faint." Now that is barbaric, isn't it? Well, this indicates the use of teams for surgery, if we can take that away from it. One person to operate, another to stabilize the patient. An Egyptian doctor also described hernia repairs. One medical text refers to pushing back a hernia and bandaging it tightly. And one account from around 1500 BC suggests surgical treatment of an inguinal hernia was attempted. Infections and complications were always a risk, and that is exactly why Egyptian surgeons stuck to what was feasible and observable. The surgical successes can be seen in the mummy examinations. Broken bones re-healed correctly, amputated toes in one case replaced with prosthetics to allow walking. Skulls with signs of trephination, drilling a hole in the skull that had healed edges, implying that the patient survived the cranial surgery by some weeks or more. Trephination was rare, by the way, but it did occur. It might have been done to relieve pressure after head injuries. Tools like copper needles and fine sutures, possibly made from animal sinew or flax fibers, allow them to stitch wounds neatly. After surgery, patients would be cared for with clean linen dressings. Egyptians were particularly concerned with cleanliness as evidenced by their frequent washing and the use of natron. It's a natural salt for cleansing. Same thing that they mummified the bodies in, by the way. This likely helped reduce infections, and they also recognize the importance of diet in recovery. For example, feeding a broth or fermenting drinks to patients to boost strength. In at least one instance, a papyrus prescribes meat and beer to a patient recovering from an illness, perhaps to build up their blood. The description of the surgery team and the patient being told not to faint during a circumcision is an odd or unusual detail that really brings home the brutal, painful reality of surgery without anesthetic. The patient undergoing a minor procedure, perhaps having an abscess lanced, would feel the initial, sharp, cold pressure of the bronze scalpel breaking the skin, followed by a surge of heat and the thick, oozing feeling of pus being drained. The air, heavy with the metallic scent of copper tools and the earthy smell of the natron used for cleaning, would make the entire environment feel intensely clinical and slightly terrifying. Historians still debate whether the successful trephination procedures were performed for medical reasons, such as treating head trauma or abscesses, or if they were carried out for purely ritualistic, magical purposes to release evil spirits causing mental illness. Overall, the evidence paints a picture of an ancient medical practice that was surprisingly advanced in surgery and emergency medicines. The Egyptian physicians' toolkit and techniques allowed them to manage fractures, dislocations, wounds, and some internal conditions effectively, and they were careful observers. Their case notes in the Smith Papyrus often say, "If you find such and such symptom, you should say, 'An ailment I will treat,' or, in grave cases, 'An ailment against which nothing can be done.'" They recognized when paralysis from spinal injury indicated a hopeless prognosis. This level of clinical assessment and the use of logical treatment protocols is a truly legitimate historical event in the history of medicine. Of course, life in ancient Egypt, often idealized in tomb art, came with a host of common diseases and ailments. By analyzing mummy remains and reading the medical papyri, scholars have identified quite a few health issues that Egyptians faced and how they remedied them, or tried to at least. It turns out that the Egyptians suffered from much the same maladies as people do today, as well as some specific to their environment, and they developed treatments for those based on the knowledge available. One widespread problem was dental disease. The sand and grit in bread from grinding grain on stone led to excessive tooth wear. Many mummies have severely worn-out teeth with exposed pulp, leading to abscesses or infections. As noted, Egyptian dentists attempted draining abscesses and properly extracted teeth when they became loose. For toothaches, prescriptions in the Ebers Papyrus included topical application of a paste made from ground beans or herbs and honey to the aching tooth, or rinsing the mouth with beer and celery to soothe the pain. They even used a mashed-up mouse as a remedy for a toothache. At least according to later Greek accounts of Egyptian practices, though it sounds a little bit more magical than medical. We don't know what the logic was behind it. This is a very odd or unusual detail. Interestingly, honey was used to fix a loose tooth by acting as an adhesive and antiseptic, and garlic or onion might be chewed to strengthen gums. The Egyptians valued onions and garlic for general health, which, they are pretty good for you. Eye diseases were very common due to the hot, dusty climate and presence of flies. Egyptian texts mentioned ailments like ophthalmia, like a conjunctivitis or trachoma, which could cause blindness if untreated. To treat eye irritation or infection, the Ebers Papyrus contains numerous ophthalmic recipes. A typical eye remedy might mix malachite or green copper ore powder with honey and apply it as an eye paint. Malachite and other lead-based materials were ingredients in the kohl eyeliner that the Egyptians famously wore. Recent studies suggest that these cosmetics might have helped prevent infections around the eyes, as the minerals have antimicrobial properties. In effect, their makeup was doubling as medicine, and they didn't even know it. Other eye treatments included mother's milk dropped in the eye, a practice oddly found in many cultures, and incense resin to reduce inflammation. Digestive troubles were another frequent complaint. Egyptian medical papyri reveal many prescriptions for stomachache, constipation, and parasites. The diet of common people heavy in bread, beer, and legumes could lead to indigestion. Laxatives were well known. The castor oil from the castor bean plant was a powerful purgative, used then as it is now in moderation to relieve constipation. A gentler laxative was figs and grapes, which they could consume to move the bowels along. For stomach pain, what we might call dyspepsia, they use concoctions like milk with herbs. The Ebers Papyrus also provides one of the earliest descriptions of colic and even suggests rubbing the stomach with oils to relieve it. Infectious diseases like malaria likely plagued ancient Egypt. Mosquitoes bred in the Nile marshes. While they did not know the cause, Egyptians noticed fevers and enlarged spleens, which is classic malaria, and tried to treat the fevers with cooling remedies. For instance, rubbing a feverish person with wine and water, or letting them rest in the breeze. They also implemented preventative measures against mosquitoes. Herodotus noted Egyptians slept under fishermen's nets as mosquito nets and used protective oils on the skin. They even fed the workers garlic and onions, which Herodotus claims was to ward off illness during pyramid building. Garlic does have some pretty strong antimicrobial properties and maybe repelled insects, so there's logic to this. Respiratory issues such as coughs, colds, and asthma appear in texts too. A cough might be treated with a syrup made from honey and herbs like thyme or warmed cow's milk with honey. For asthma, the Chester Beatty Papyrus prescribes breathing the fumes of heated herbs. Essentially, an inhalation therapy, possibly using mixtures that include jubin, juniper, or frankincense to clear the airways. Kind of like an early Vicks Vapo Rub, if you know what that is. One interesting remedy for asthma was to heat a concoction on bricks and have the patient inhale the smoke. The patient suffering from a chest cold would feel the heat and sting of the herbal vapors filling their lungs, the strong, pungent smell of burning juniper and resin momentarily overwhelming the sense of congestion. The cool cloth soaked in wine and water being applied to a feverish forehead would feel like a shock, providing a brief, soothing relief from the intense, radiating heat of the fever. Historians still debate whether the Egyptians fully grasped the prophylactic or preventative effect of the malachite in their coal, or if its use against eye infection was merely an accidental byproduct of a religiously or cosmetically motivated practice. But perhaps the most striking is that the ancient Egyptians seem to have identified serious diseases like diabetes and cancer, albeit in rudimentary terms. The Ebers Papyrus contains a description of a condition with, quote, too great emptying of urine, essentially excessive urination. This is now interpreted as an ancient recognition of diabetes mellitus, particularly since they noted ants being attracted to the urine, a sign of sugar content. Although the papyrus itself just focuses on the volume. For this, they recommended dietary changes and certain plant concoctions to reduce thirst. As for cancer, the Edwin Smith Papyrus describes bulging tumors of the breast, noting this is an ailment for which there is no treatment. This is likely the earliest written reference to breast cancer, acknowledging its grave prognosis. Other papyri mentioned swellings or wens, that is, benign tumors, and in some cases advised cauterizing them or using poultices of arsenic or other caustic substances to try to shrink them. While of course they couldn't cure internal cancer, the Egyptians did attempt to treat surface tumors or lesions, early forms of tumor therapy, by cutting and burning. Well, they certainly did confront a wide spectrum of health problems with the knowledge and resources they had at hand. They combined observational skills with extensive materia medica, that catalog of remedies, to alleviate suffering. And many of the treatments were surprisingly effective. Wounds healed, dental abscesses drained, parasites expelled, and some illnesses managed well enough. But without all the modern technology, they had limitations. Infectious diseases often proved fatal, and life expectancy was much shorter than today, perhaps about 30 to 40 years on average, though some individuals did live a bit longer. Yet, through trial and error over the centuries, they amassed a rich tradition of treating the sick, making them the most renowned healers of the ancient world of their time. Well, it's about time we talk about the plant-based and mineral remedies, the pharmacopoeia, if we can call it that. Well, it was largely derived from the natural world, of course, especially plants, but also minerals and animal products. We've mentioned quite a few of them. With the fertile Nile Valley and desert oases, Egypt had access to quite a few medicinal plants, some locally grown and some imported from distant land by trade caravans. The medical papyri contained hundreds of recipes listing ingredients, often in, like, a cookbook fashion, giving us a clear idea of what the Egyptians were doing. Herbal medicine was a cornerstone of a treatment. Common staples of the Egyptian herbal toolkit included garlic, onions, coriander, cumin, aloe, cannabis, even frankincense, myrrh, juniper berries, mint, thyme, and many more. Garlic and onions were virtually panaceas. They were consumed daily for general health and given to laborers to increase stamina. In medical texts, garlic is recommended for conditions ranging from heart problems to parasites. Modern science has found garlic to have antimicrobial and cholesterol-lowering effects, validating its use as a health tonic. Coriander and cumin appear in recipes for digestive troubles. They likely helped with indigestion and gas. Aloe vera was known for soothing skin conditions. Egyptians used the gel of the aloe plant to treat burns and skin irritations, much as we do today. Cannabis, or hemp, is mentioned in at least one papyrus as an ingredient in an eye remedy, perhaps for glaucoma or inflammation, which would have analgesic effects. But one of the most frequently used plant products was castor oil pressed from castor beans. This potent laxative was given to relieve constipation or purge the system. The papyrus Ebers also suggests castor oil as a base in other ointments for skin conditions. Senna pods, a natural laxative, were used similarly for purging. On the other end, for diarrhea, Egyptians turned to binding remedies like pomegranate rind or acacia gum, which have tannins to reduce intestinal motility. Mint and caraway were also used as calming teas for upset stomachs. They were also among the first to use certain resins and gums medically. Frankincense and myrrh, both aromatic resins from trees in the Horn of Africa and Arabia, were not only burned as incense, but also incorporated into salves for wounds and sores. Willow bark was used to reduce pain and inflammation. Interestingly, willow actually contains salicin, a compound related to aspirin. Thus, when an ancient Egyptian chewed on willow bark for pain relief, they were unknowingly utilizing a natural source of something akin to aspirin. This accidental discovery of ancient pain relief is a legitimate historical event. The patient chewing on the willow bark would experience its bitter, acrid taste coating their mouth, a taste that signaled the relief of pain that was soon to follow. They would feel the grainy texture of a healing poultice, perhaps made with aloe gel and resin, cool and soothing as it was spread onto a painful burn, and the accompanying powerful, distinctive smell of myrrh, deep and slightly sweet, filling the air around them. The widespread use of willow bark for pain relief without knowing about salicin is an odd or unusual detail that highlights the power of empirical observation over theoretical knowledge. Historians still debate whether the ancient Egyptian healers had a concept of active medicinal ingredients, or if they simply relied on trial and error, associating the ingestion of certain plants with desired symptomatic relief. They also used opium from poppies, likely as a sedative or a pain reliever, though they didn't really know that high doses were risky. They even treated mental health issues to some extent. For depression or grief, the Egyptian prescription might not be a herb, but an activity. One papyrus recommends that a patient walk in the sun with fine oil on his head to alleviate sadness. The recognition of therapeutic activities beyond ingestible medicine. Well, taking a walk and getting a bit of sunshine, that does certainly help if you're feeling a little down. The texts show a sophisticated knowledge of dosing and compounding. Remedies were prepared in various forms: pills, drinks, ointments, poultices, suppositories, pessaries, fumigations, and enemas. They had 5 basic routes of administration: oral, rectal, via pessaries, topical, and via inhalation. A prescription in Ebers might read something like, to remove pain in the side, crushed celery and beer, take for 4 days. Measurements were given in units like the hin, about half a liter, or a spoonful, showing an attempt at standardizing quantities. They often used beer, wine, milk, or honey as vehicles to deliver medicine, since those could dissolve or carry herbal extracts. Wine was employed as a solvent to extract plant essences, and beer was common for mixing in herbs and making them more palatable or potent. Of course, honey deserves its special mention as a wonder ingredient in Egyptian medicine, and not just Egypt, pretty much all over the world. It was present in an enormous number of recipes. One review notes honey in about 500 prescriptions beyond wound care, as discussed. It was given for coughs, sore throats, and even to fix a loose tooth. Modern research confirms its antibacterial effect and soothing properties, so there is that in hindsight. But also beeswax, a related product, was used as a base for making salves and creams to apply for the skin. In fact, a variety of animal-derived products found their way into the pharmacy. Fat from animals such as goose fat or ox fat was frequently used as a base for ointments. For example, a burn might be treated with a salve of goose fat and thyme. Milk from cows or goats was a common diluent, and also an ingredient in fertility or woman's remedies. Eggs, usually from ostrich or chicken, appear in some recipes, either the yolk or shell for different conditions. And even more exotic, lizard blood, crocodile dung, mice, bats, and various organ meats appear in some recipes, likely for the sympathetic magical effect. For instance, there is a cure for baldness in the Ebers papyrus, suggesting rubbing the scalp with a mixture that includes hippopotamus fat, possibly because the hippopotamus was hairy or symbolically strong. This use of animal fat is a very odd or unusual detail that straddled the line between practicality and symbolic magic. While many animal ingredients were probably placebo or symbolic, some had some real effects. Mouse paste for a toothache might have been simply a way to apply enzymes or a distracting counter-irritant. Crocodile dung in contraceptives, aside from acting as a physical barrier, creates an acidic environment that could act somewhat like a spermicide, but it's certainly not a method that you would recommend today. That is for sure. Well, they also used animal bile for its detergent properties in laxative preparations, and brain, often from animals, appears in a few remedies. Perhaps a source of fat, or because of magical thinking associated brain matter with neurological cures. The systematic use of animal products, particularly the bizarre ingredients like the hippopotamus fat for baldness, is a legitimate historical event demonstrating the extent to which they utilized every available resource, physical or magical, for healing. The patient taking a thick, potent draught would feel the cloying, heavy sweetness of honey on their tongue, meant to mask the strong, earthy, and often bitter taste of the herbs and pulverized minerals mixed into the beer or wine base. The medicinal drink would feel warm as it went down, sometimes causing a slight, immediate burning sensation in the throat before the herbs began their work. Historians still debate whether the incorporation of bizarre animal parts into remedies was a necessary ritual component for the remedy to work, or if it was done to make the remedy so repulsive that the patient would believe it possessed immense power, thus enhancing the placebo effect. But healing in ancient Egypt was not confined to clinics and papyrus texts. You could always go to the temple if you were a little bit more desperate. Perhaps temples were not only religious centers, but they were hubs of learning and sometimes medical practice. Many temples featured special areas, or adjunct buildings, that functioned as sanatoria, where the afflicted could come and seek cures through divine intervention, especially if everything else had failed. Priests who served the gods often doubled as healers for the community, and certain deities' temples became famous for cures. A prominent example of this is, of course, Imhotep and his cult in later periods. Centuries after his death, he was venerated as a god of medicine. And by the first millennium, BCE, and into the Ptolemaic era, people would travel to Imhotep's temples, such as the one they had in Memphis and another in Saqqara. They did this in hopes of receiving miraculous healing. These places functioned similarly to the Greek Asclepieions. Pilgrims would come with offerings, pray or undergo rituals, and often sleep overnight in the temple, a practice known as incubation, hoping that the god would send them a curative dream or vision. In fact, archaeologists have discovered inscriptions and votive stelae left at Imhotep sanctuaries thanking the god for healing miracles. For instance, restoration of sight to the blind or cure of a crippling illness attributed to Imhotep's divine intervention. His Greco-Roman equivalent was Asclepius, and indeed the Greeks in Egypt identified him, with him blending traditions. However, before Imhotep was fully deified, Egyptian temples were sites of healing. Another healing goddess, Isis, had temples like on the island of Philae in the south, where people sought cures. Isis, being the magical healer who resurrected Osiris and healed Horus, was believed to help devotees with anything from snake bites to infertility. The priests performed rituals that included the reading of magical spells, some inscribed on metal or stone and displayed in the temple. A famous artifact is the Metternich stela, 4th century BC, a stone slab covered in spells of Isis and Horus for healing bites and stings. Water would be poured over the stela to imbue it with the power of the spells, then collected for the patient to drink, thus ingesting the magic along with the water. Remember that crocodile dung sunscreen? These folks really liked ingesting weird stuff. Temples of Sekhmet were naturally associated with healing as well, albeit in a somewhat fearful way. Priests of Sekhmet were essentially the physician class at times called upon during epidemics. Pharaoh Amenhotep III of the 18th dynasty commissioned hundreds of statues of Sekhmet, possibly in hope of keeping disease at bay. At the Temple of Mut, a form of Sekhmet in Karnak, numerous Sekhmet statues stood, and it is thought the priests there practiced most preventative rituals to appease Sekhmet daily, and healing for those struck with illness. We hear of Sekhmet priests being summoned when plague or pestilence broke out. Their role was to perform ceremonies to pacify Sekhmet's rage, and thereby end the epidemic. The use of temples as centers for incubation healing is a legitimate historical event that highlights the deep spiritual dimension of Egyptian healthcare, a system where faith was as important a treatment as any herbal remedy. The patient, lying down on a simple mat within the quiet, shadowy walls of the temple sanatorium for incubation, would feel the smooth, cool stone floor beneath them, a stark contrast to the rough matting. The smell of dust and old masonry would be dominant, mixed with the intense, aromatic scent of freshly burned offerings, probably costly resins, designed to please the deity and purify the air. The silence would feel profound, broken only by the soft, rhythmic chanting of a distant priest, a sound that lulled the hopeful pilgrim toward a potentially curative dream. The odd or unusual detail here is the practice of pouring water over the Metternich stela to create a magical draught, literally using a stone monument as a spiritual pharmacist. Historians still debate whether the miraculous cures recorded in temple stelae were genuine cases of psychosomatic healing induced by the placebo effect and faith, or if the priests operating the sanatoria also provided standard, practical medical treatments alongside the spiritual rituals. Well, in many ways, the ancient Egyptian medicine was the cradle of later medical developments. The Greeks acknowledged their debt to Egypt. Figures like Hippocrates and Galen knew of Egyptian practices. But within Egypt itself, the tradition remained uniquely syncretic. Even as late as the Roman period, Egyptian priests at temples like Philae were performing healing rituals that traced back to pharaonic times. The legacy continued in a direct line. Some Coptic Egyptian remedies recorded in the early Christian era are virtually identical to those in the pharaonic papyri. Ultimately, what stands out is the enduring human aspect of Egyptian healing. The voices in the papyri, whether confidently prescribing a gargle for a sore throat or lamenting that a tumor has no cure, are voices of early scientists grappling with the same challenges that healers face today. They used the best tools and understanding that they had. And remarkably, many of their solutions were pretty sound. They acknowledged when they were outmatched by disease, but they rarely gave up, invoking divine help when human skill had reached its limit. This blending of the rational, the empirical, and the divine is the hallmark of the holistic Egyptian view. The Egyptian approach was not about separating the mind, body, and spirit. It was about treating the whole person and their environment. The concept of ma'at, cosmic order, extended to the body. Sickness was disorder, and the physician's job was to restore that balance using every means available: a surgical knife, a specific herb, or a powerful incantation invoking a god. This commitment to a comprehensive approach is a legitimate historical event that set their medical tradition apart. They weren't just fixing a broken arm, they were fixing a broken piece of the universe. That's a lot of pressure on a doctor, even one called the shepherd of the royal rectum. And so the story of medicine and healing in ancient Egypt is a story of innovation tempered by tradition. It reminds us that the path to modern medicine was not sudden. It was paved over millennia by dedicated physicians of the past. In the limestone necropolises and faded papyri of Egypt lie the roots of clinical practice, pharmacy, surgery, and holistic care. The enduring influence of their materia medica, remember the willow bark, the natural aspirin, is an odd or unusual detail that confirms how empirical knowledge can transcend millennia, even without the backing of modern chemical analysis. The sheer luck of choosing a plant that actually works is astounding. The elderly priest-physician, carrying the weight of ancient knowledge, would feel the familiar dry, papery friction of the ancient scroll as he carefully rolled it up, its task complete. He would feel the sun's warm, comforting weight on his back as he walked out of the cool temple shadows, the pervasive, heavy scent of the Nile mud and fertile earth reminding him that all healing, both spiritual and physical, ultimately came from the land and the order it represented. He'd feel the rough, cool stone of his amulet resting against his chest, a constant physical connection to the divine forces he commanded. Historians still debate whether the holistic integration of magic and medicine ultimately advanced or hindered the development of purely empirical science in Egypt, considering the highly rational surgical texts were ultimately eclipsed by later, more magic-heavy compilations. The long journey through the history of ancient Egyptian medicine along the Nile now comes to a gentle close. We've seen the physician-magician, a figure of immense respect, navigating the complex world where a simple poultice of honey was as crucial as a spell whispered to Sekhmet. From the almost modern, methodical case notes of the Edwin Smith papyrus, detailing trauma and showing a surprising capacity for surgical triage, to the vast pharmacopoeia of the Ebers papyrus, brimming with hundreds of herbal, mineral, and occasionally bizarre animal remedies, the Egyptians established a foundational system of healthcare. They understood the body through its vessels, diagnosed conditions like diabetes, and treated everything from dental abscesses to scorpion stings, all while seeking to restore Ma'at, the cosmic balance. Remember the houses of life, the temple sanatoria, where hopeful pilgrims sought divine healing through curative dreams, and the simple efficacy of willow bark, their accidental aspirin. The legacy of these pioneers is immense, a tapestry woven with rational observation and deep spiritual faith, which ultimately informed the medical traditions of the Greeks and Romans. Now, let the ancient wisdom of the Nile drift away. Your long day is over. Rest well and find your own perfect balance, your own Ma'at. Good night.